This 39-year-old has been living with HIV for 4 years. She helps scores of people in accessing their treatment. She too has had difficulties in accessing her medication. It's a bitter pill to swallow.
The challenge that I have with this COVID-19 when I collect medication at the clinic, the regulation says we are not supposed to be on the streets but indoors. When I get to the clinic, I queue for 4 to 5 hours. The system is very slow. There's too many of us. Sometimes I would return without medication.
The lockdown has exposed gaps in the already strained health system. Dr. Lucky Masibuko is a social justice activist. He's been living with the virus for almost 3 decades.
Do you find that there's a shortage because of deliveries? There's a shortage because of logistical issues. It's not widespread at the moment, but there are serious concerns that if it really gets worse, any worse than it is, then it will have an adverse effect. In South Africa, we have 7 million people living with HIV. Only 4 million are on treatment. So, which means in numbers, approximately 3 million people are on compromised immune systems.
Drug resistance could undermine HIV gains.
We have the largest treatment program in the world. So we have made significant progress over the last years in terms of getting people tested, keeping them on treatment. Before COVID, we were doing very well in terms of getting South Africans accessing HIV testing. What we're not doing very well around was retaining everybody on treatment.
To prevent defaulting on treatment, many activists are working tirelessly in their communities to get life-saving medication to those in need. Gillian Pillay, SABC News, Soweto.